Once a patient walks into the Center for Urologic Care, we can really provide them expertise from stem to stern.
There's a textbook treatment for each patient, which I can look up in a book, but quite frankly, that doesn't necessarily matter if you're not meeting what their goals of care are.
They've come in, they've admitted that they have a problem, which is personal, and we get that. And to help them move past that, it's very rewarding.
So the Center for Urologic Care is a private practice urology group. We have 4 physicians, 1 physician assistant, and we are dedicated to helping people with urologic problems, which include but aren't limited to cancers of the urinary tract such as kidney, bladder, prostate, urinating problems, and other urologic issues.
So we really run the whole gamut of treating urologic patients, and again, between the 4 of us, we have every aspect of urology covered, and we feel like we can treat it in a very sophisticated way.
We really work as a team. That's the goal, and I think the benefit to the patients.
They're going to feel very comfortable, and I'm going to feel very comfortable with them talking to one of my partners. And so there's never a time really where someone can't be seen as soon as they want to. And so there's a lot of comfort in that.
You know, we are an independent practice. I think what that means for patients is that we see a whole host of different insurances. Some patients have insurance needs where they need to have a procedure done at one hospital or another, and we can usually facilitate that. And it's a benefit for primary care doctors because they don't necessarily need to think about whether they can refer to our practice or not.
That's a component that allows us to treat the patient in the best way possible without any obligations or algorithms that we have to follow.
Nobody ever wants to go see the urologist, but there's a good chance that every person at some point in their lives is going to need a urologist.
Whenever anybody walks into any type of doctor's office, obviously there's some apprehension and anxiety, but we try and instill in both the front office staff, back office, and with us as physicians to try and make you as comfortable, the patient as comfortable as possible.
Based on our waiting rooms and just artwork, it's a comfortable, at least it's a less anxious place to be.
We're here for the patient. We want to help you. And we're just normal, regular guys that understand the process that everybody goes through and the apprehension that everybody goes through going into any physician's office.
You know, at the end of the day, I hope that whenever a patient leaves here, they feel like I've listened to them, that I understand their problem, and that I'm doing everything in my power to try to correct their problem.